Hi, and welcome back to my channel. So great to have you here. This video is going to talk about the differences between labor and delivery and postpartum or mother baby. And this video is great for people who are looking to switch specialties or go into this specialty or new nurses. So definitely, if this is something that you are interested in, keep watching. Make sure to like, comment, and subscribe. And let me know what you guys think of this video and or any questions you guys have that I didn't mention in this video. Let me know down below. All right, let's get right into it. In the labor world, us nurses are there at bedside helping mom transition through her different stages of labor, and we are there when the baby comes out at delivery. And in postpartum, us nurses are there for mom and for the baby when there are different changes in mom. We're there to notice those different changes. We're there to help with baby and notice different changes in baby, doing our assessments and vital signs and noticing how we can help mom bond with baby and feed baby and do all the things to prepare them to go home and live their lives outside of the hospital. And we are helping mom in the postpartum period with pain control. We're helping educate her through the difference between her having and taking care of her baby in her womb. Now she's having to learn how to take care of the baby outside in the real world and having to learn how to cope with the different changes in her sleep pattern and learning her different cues when the baby is hungry. And all those things are things that we teach the mom in the postpartum world. In the labor world, we are helping mom with pain management as well. We're doing all sorts of different procedures with mom, helping to induce her or helping with pain management with her. And we are watching the baby's heart strip to watch for different heart rate changes that tells and communicates to us how baby is doing in the womb and how happy baby is tolerating labor or how upset baby is with labor. So those are really the biggest differences that we see in the labor and delivery process. Our nurse to patient ratio we have for labor and delivery is 2-to-1. So 2 patients to 1 nurse, or 1-to-1 depending on how severe the patient load is. And in postpartum, we have a 4-to-1 patient ratio. So we have 4 couplets to 1 nurse. But that is a mom and a baby. So broken apart, it is technically 8 patients that you're dealing with, but it's 4 rooms. So kind of like the mom is helping take care of the baby. So really you're not doing too much of like patient care with baby. You are doing different labs and doing, changing diapers sometimes, but you're not there to take care of the baby. That is what the mom is there for. So you were there to just help mom educate and all that. So there is a larger patient load that you're having to take on in postpartum compared to labor and delivery. And the charting is different. A lot of the charting in postpartum, you're charting on mom and you're charting on baby, and you don't have to do it in real time like you do in labor and delivery. When things are happening in labor and delivery, you have to do it the exact time that it's happening. You're gonna have to watch the baby strip and chart along the baby's heart strip to say how it's doing. So there's more real-time charting in labor and delivery, so you really have to stay on top of that along with your nursing interventions and nursing care. So there is all of that, starting off with the differences between labor and delivery and postpartum. In postpartum, I honestly did not feel like I was a real nurse, and that was one of the reasons why I have left the specialty, because you really don't use a lot of your nursing skills in postpartum like you do in labor and delivery. I remember there was a time where we were trying to put a Foley in a patient, or we were trying to in and out a patient because she hadn't peed in the allotted amount of time that we need them to pee after they deliver. And we had to have like 4 nurses like come in and try and in and out cath this patient. But it's because we don't normally handle Foleys and in and out catheters, and we were just so like fumbled with how to do it. And so we had to call upon one of the L&D nurses to come and help us. And it's just not something that we do on a daily basis. And I really felt like I was losing my skills because it was me coming right out of nursing school, going into a specialty that really didn't use a lot of skills. And I felt like I wasn't, strengthening stuff that I had learned and reinforcing the things that I had learned after nursing school. So that's one of the reasons why I feel like if you're someone that is really looking to strengthen their skills or like keep their skills up in nursing, in the nursing field, postpartum is where your skills are not very utilized. In labor and delivery, I use my skills every day. I'm in there like popping IVs in, sliding Foley catheters in, doing all sorts of different procedures with the patients and with the doctors. And it's a lot more, like I feel a lot more like a nurse, like I'm doing nurse-like things. And that's something that I really needed to kind of confirm that, okay, like I've made it, like I made it to be like a nurse. So that is definitely a reason why I had left the specialty. A lot of the postpartum things that we are doing, we are doing our full assessments, we're doing our vitals and rubbing the fundus to check bleeding. Like we are still at risk for hemorrhaging on that side. And we are teaching breastfeeding. There's a lot of education that goes on in postpartum. We are helping with baby. We are dealing with feedings. We're dealing with for baby, we're dealing with sugar, like glucose issues. Moms, we're dealing with sugar issues. We're dealing with blood pressure issues. Sometimes we're also dealing with things like bilirubin, like high bilirubin levels for baby and needing to put them on like a phototherapy lamp, and just all sorts of different things that can happen. New moms have all sorts of new anxiety that comes up and questions and things that you have to reinforce and like extra teaching. And if the patients are coming in with like no knowledge at all, it's a lot more in the room teaching and like reaffirming and reassuring them that everything's going okay. So with labor and delivery, you're kind of like dealing with the situation at hand. Like you're letting them know, okay, this is what to expect. And you're in there helping, supporting mom, being an advocate when it comes to procedures. And there you're really having to step up and be that advocate for the patient, because there are a lot of situations where, they don't know what's going on. They don't know what's normal. And so you're there to like let them know, hey, this is what is going on, and you need to make an educated decision as to how you want to go forward. So it's a lot more, critical life and death situations on labor and delivery. And we are having to do a lot of different, like every day is just so different, with each delivery is so different. So there is just a big separation as to like the nursing process when it comes to labor and delivery and postpartum. So yeah. Another big difference is like when it comes to my scheduling, I feel like I'm not able to do 3 in a row as easily as I was on postpartum. I feel so exhausted after just like 2 nights in a row. I'm like, oh my gosh, I have to come back for a third. Like I'm not able to pop back up right after like I was in postpartum. Night shift definitely is difficult, but with labor and delivery, I don't get a lot of breaks. I hardly am able to clock out for a 30-minute break because we are constantly monitoring our patients, monitoring our like babies, and making sure things are going okay. On postpartum, we are not very consistent with like how often we're monitoring. Like we do every 2 hours, like checking their vitals and stuff, but we're not having to watch a screen like we are in labor and delivery. Like labor and delivery is a lot of screens, a lot of wires and stuff. So in postpartum, they're more like, the patients are more free, they're walking around, and they're not in bed as much. So I really can see why I'm like a lot more tired, because it's like just a lot more movement, a lot more watching, and I can't get my breaks like I was in postpartum. Like every day I would clock out for my 30-minute break, but on labor and delivery, that's not a thing. So it's, if I'm able to, I do clock out, but a lot of the times there are nights that I'm going 12 hours straight working. So yeah, really, really hard to work 12 hours shifts and not get a break. That's why I'm so exhausted after 3 in a rows and stuff like that. So definitely, if that is something that's important to you, make sure you are asking your unit, like if you are going into a new unit, how their lunches work, like how do they get breaks, what is the system that they use, because that's an important thing to know, like how are you able to step away from your work, because it is very difficult not to be able to break away from your from your patients and take a moment for yourself. So yeah. And I feel like when it comes to postpartum, you're really autonomous with how you're working. Like there is a lot less need for a physician being there, or like a physician, needing to call a physician. There are some times that, there was one time that my patient was hemorrhaging, and yes, I needed to call the physician. But postpartum, there's not a lot of like interaction with the doctor unless there's something really going wrong. There are some cases where we have to contact the neonatologist about baby, or talk to our charge nurse about a situation that we kind of just need advice about. But labor and delivery, things happen so quickly, so sudden. We need orders for new things, order for new medications, and there's all sorts of things happening all the time. So I'm grateful that I'm at a hospital that's a teaching hospital, and my doctor or my physicians are right there walking around. They're there for me if I need to talk to them about something, or if I need orders about something. So I come from like the the hospital that I came from was not a rural hospital, but it was a lot smaller than the hospital that I'm here now. My hospital here is like an inner city, level 4 NICU, level 1 trauma. So we have a lot more things going on, and where we need the doctors being there, it's very helpful. So I hope that gave you some idea of how the postpartum world is compared to the L&D world. And I really have no like preference as to which one's better. Like there's so many like pros and cons with both. If I were to pick one, I would say labor and delivery, just because of how exciting labor and delivery is and how I feel like a real nurse. That was something that was so important to me. When I was in postpartum, I did not feel like a real nurse, and it kind of just like, I don't know, like it just didn't feel good. Like I now feel like, okay, I'm in it. Like I've made it to feel like a nurse and made it to do nurse-like things. And I feel like I needed that for just my personal like ego, I guess. So it's not a bad thing. Like it's just something that I feel like I needed to feel after graduating, to say like I made it. So I definitely do like that postpartum is a little bit more, and I say laid back loosely, but it's a lot more laid back than it is on labor and delivery. But I do miss my babies, and I do miss the care that I used to give them. So I hope that one day I can make it to where I'm doing both labor and delivery and postpartum in like the same hospital as an LDRP, that's what they're called. So I would definitely recommend that if you're someone that can't choose and really want to just do both. That's a great option. But I'm getting so much experience here at this hospital that I'm at. It's a great teaching hospital, great for people that are looking to gain their skills and opportunities for growth. So hope that this video sheds some light, and I definitely am here for y'all if you have any questions. Check out my other videos. I make nursing related content, I make lifestyle videos, and I make travel content. So definitely check out those videos, and I hope to see you guys on my next video. All right, thanks for stopping by. See you guys next time.